Hey everybody, it's Dr. Dave, Psychiatry. Thanks for the YouTube channel today. I'm here again to remind you that if medication fixes the problem that you have, then that's a medical problem, not a mental problem. Today I'm talking about one of the medicines that I use very frequently in my office as a dopamine suppressor. That medicine, the brand name is Zyprexa. The generic name is olanzapine, O-L-A-N-Z-A-P-I-N-E, olanzapine. And Zyprexa olanzapine is a medicine that I've used for decades. And I was prompted to make this video because I saw a gal last week who had stopped her Zyprexa, did very poorly after having stopped it, resumed it, and did remarkably well within 3 or 4 days of going back on it. So Zyprexa is one of those medicines that I've used for, as I said, a long time to help people. And I think it's a fairly misunderstood medicine in some ways. And so I wanted to do a product-specific video about Zyprexa, and it is really among one of the lead products that I use in dopamine suppression. So you've heard me talk about dopamine before on the channel. If you haven't, you can go back and listen to some of those videos. But dopamine, in my view, really does two things in your brain. Number one, it controls your movement, and number two, it controls your thinking. So since I'm not a neurologist, not a movement doctor, when I'm using Zyprexa, what I'm using it for is to help control thinking. So just to review that and talk about a little bit more, if I hold my hand here and say this is the normal range of dopamine that you should have, dopamine activity that you have in your brain. If you make high levels of dopamine, excess levels of dopamine, that can cause excess thinking. So overthinking is the primary symptom of too much dopamine. And I say that because medicines that reduce dopamine help people think less. Now, there is a range of overthinking. So I saw a patient this morning, and actually Zyprexa is the tool that I'm going to use to help her. First, she chose that among all the different chemical problems she's having. She said overthinking is her primary problem, so we're going to use a dopamine suppressor, Zyprexa, for her and see what happens when she comes back in a couple of weeks. And basically what I described for her is the range of dopamine excess. So if I just had a piece of paper with her like I did, and I said, okay, well, if your dopamine is down here and it's too much, well, that's enough to make you think too much, worry too much, can't shut your thoughts off. Sometimes it's just something as simple as laying in bed and can't stop thinking about things. But if it's a little bit more, if it's back here, if it's too high this direction, higher 9-hour, which I'm going to go with this. If the next set of symptoms is more like, man, I can't stop thinking about this. I'm getting more and more enraged, more upset about things. The next level is, gosh, I can't believe that I'm starting to think about things that are almost not real. Like, I can't believe I'm really thinking this stuff. The FBI is not after me. I'm not really certain of that, but I'm starting to feel a little bit paranoid. All the way to now, I'm hearing voices, believing things that aren't true. I'm having delusions, hallucinations, and I'm basically not in touch with reality anymore in terms of my thought process. So that's when it's all the way back here or all the way up here, that's called psychosis. And doctors talk about psychosis all the time. Well, when psychotic symptoms were first treated with dopamine suppression, well, the FDA approval language on these medicines is they were anti-psychotic. So the anti-psychotic name, moniker, categorization is something that people attach to Zyprexa. And if you read about Zyprexa on the internet, you're going to read about schizophrenia and antipsychotic. But we've known for decades that people that are not psychotic, that don't have delusions, don't have hallucinations, and don't believe things that are not true, but simply can't shut their mind off. So in other words, if their dopamine level is not all the way up here, but it's down here, still too much, but it's not all the way out, what you would call crazy amounts of dopamine excess causing crazy thoughts, which is what average people call delusional thoughts. If those people that are making too much dopamine but don't have psychotic symptoms, well, they still benefit from dopamine suppression, which is why I talk about dopamine suppression as a technique. So this is an example of off-label treatment. We're not using this for a diagnosis of schizophrenia. We're using it as a chemical treatment to push down dopamine. And so if you have psychotic symptoms, it's fair to talk about antipsychosis. But with the patient that I saw today and the one I saw last week and most of my patients that I have in my practice, it's really not about psychosis. It's really about just can't stop thinking or thinking too much, overthinking. And that range of non-psychotic overthinking is what we're talking about. So long and short of it is, when we see that target and we want to push dopamine down from if it's supposed to be here and it's here and it needs to be here, then Zyprexa is a tool that does that effectively. And a lot of times, one of the things I like about Zyprexa is people that take Zyprexa, olanzapine, they feel better sometimes in 3 or 4 days. It doesn't typically take very long. It's not, you don't have to wait weeks for this to work. So it's different than the serotonin boosters and some of those other medicines. It's really true that when we hit the target with dopamine suppression, people say, I feel better in 3 or 4 days. The gal that I saw last week who had stopped her Zyprexa, she said by the 3rd or 4th day, she just felt like a different person. She went back to feeling herself. So sometimes you get dramatic, clear results from pushing dopamine from here to here. Now, as far as the FDA approval, one of the things that has happened with Zyprexa, it was actually approved for this condition called treatment-resistant depression. So what Zyprexa was used in combination with Prozac to make a product called Symbyax. And what we know about treatment-resistant depression is that if you just use the so-called antidepressants, in other words, if all you focus on is serotonin boosting or norepinephrine boosting, a lot of times those patients don't get better. And it takes some dopamine suppressor to help them. So in my view, I don't call that treatment-resistant depression as much as I call that the need for dopamine suppression. So in other words, if you have low serotonin, you need that pushed up with one medicine. If you also need dopamine suppression, if your dopamine serum needs to be pushed down, then that second tool, Zyprexa, is what does that. But there's actually an FDA approval for Symbyax, which is a joint product combination of fluoxetine, Prozac, and olanzapine Zyprexa that is approved for treatment-resistant depression. My view, chemically, there's nothing magic about treatment-resistant depression. Really, all Zyprexa is doing is pushing down dopamine. And if dopamine excess is your problem, that's what you need. So going to the mechanics of Zyprexa, you can get on the internet and read about this because there's other sources, and you can read all about it on the Zyprexa website about the dosage range and the side effects and things of that nature. I'll just talk about my experience in the office. Zyprexa, typically I start with 5 milligrams, and it has dosing notches of typically 5 milligrams. So 5, 10, 15, 20. With those dosing notches, I will ask a patient to remain at one of the dosing notches, say from 5 to 10, at least a month. Now, I typically see people that respond in a week or two, so sometimes they'll be fairly urgent, and I will, in certain circumstances, increase the dosage at 2 weeks. But a general 1 month is a good trial. Sometimes we go faster, but in general, you're in pretty safe ground if you're doing Zyprexa in the dosing notches of one notch for 1 month. And so again, that would be 5 milligram, 10 milligram, 15 milligram, 20 milligram. For people that are medication sensitive, a lot of times they'll want to start at 2.5 milligrams. That's fine, and they can cut the 5 in half. Although there's not a scored line on the pill. As far as the generics, I'm not really aware of. I know back when it was the brand name only, you couldn't cut the Zyprexa tablet in half. There was no score line, and that caused some people some problems. Well, it turns out that it's not really an issue with the medication. The reason that the manufacturer doesn't like people cutting the 5 milligram tablet in half is that Zyprexa, because of what it's made with in terms of the chemicals, it sort of like an apple. You know, if you cut an apple in half and eat the first half of the apple, and then the next day you go back and the other half of the apple is brown, well, that's called oxidation. So that reacts with the oxygen in the atmosphere, that makes the apple brown. It really doesn't affect the medicine, so people do it all the time. The company doesn't recommend it, but patients do that, and they tell me that that's what happens. And to my observation, it doesn't change the effectiveness of the medication at all. If you've gone to 5, 10, 15, 20, once you get to 20, 20 is the upper FDA limit. I consider that to be the top limit. If I've got somebody at 20 milligrams of Zyprexa and they're not getting the effect that we need, then I'm just going to go ahead and change something else or question my hypothesis whether or not that's the right medicine for them. As far as side effects, Zyprexa has early on had a lot of concern. There was a lot of concern put out, I think, in the media or maybe culturally or maybe on the internet, that Zyprexa caused what's called metabolic syndrome or pre-diabetes. Now, in my opinion and my observation is that it was much more true that patients that had actual schizophrenia had more problems with unstable blood sugar when they took Zyprexa. Patients that did not have schizophrenia, that is to say patients that were what I call low-level dopamine excess patients or off-label overthinking but not psychotic, whatever you want to call that, if it gets diagnosed generalized anxiety disorder or something like that. If we're using an off-label for that, I did not personally see a lot of patients had trouble with unstable blood sugar. However, I certainly have seen a few that did have a change in their blood sugar, and some actually said, Dr. Holmes, I never realized that I had pre-diabetes until I took Zyprexa because my blood sugar went above 200 and now we have to stop the Zyprexa. The interesting thing about those people is, in my experience, the only ones that had that problem already had the pre-diabetic characteristics already. They had family history of diabetes, they were overweight, so had the typical picture of patients that develop insulin resistance, which causes the pre-diabetic picture. Nevertheless, if somebody comes back and says, hey, my blood sugar went from normal 100 to abnormal 250, well, there's nothing we can do. We obviously just have to change the medicine. But I certainly would not want people to not try olanzapine, not try Zyprexa based on the fear of what's called metabolic syndrome, because the statement that Zyprexa causes diabetes is really, in my opinion, is an overstatement. Certainly you have to have concerns about other medical conditions getting worse, but in my experience, I've not seen Zyprexa cause diabetes or cause metabolic syndrome in the absence of other factors, except in very rare cases. As far as other side effects, the most common side effect of Zyprexa is that it can make you tired. So it makes it a very good sleep aid for some people who can't shut their mind off. They're laying in bed and they're droning and droning and droning, can't stop thinking about things. Zyprexa is a very effective tool to help people think less, worry less, more able to shut their mind off, and thus be able to sleep. It is certainly a problem when people take Zyprexa too late in the evening. People that take Zyprexa right at bedtime, a lot of times say they have what they call a hangover the next day, that they have a harder time waking up. And certainly if you take it in the daytime, if it's your time that you're supposed to be awake and you take Zyprexa when you're supposed to be awake, obviously that can cause you to be sleepy, and that's a problem. So if you're trying to figure out what's best for you, obviously if you are working some third shift or something like that, and 8 a.m. is your bedtime, then certainly take it 8 a.m., which is your bedtime. But if you're working a normal shift, a normal daytime with normal daytime hours, most people take Zyprexa right after their evening meal. Now, so if that's 7:30, 8:30 at night, whatever that time is, and then once you tell people to give people that guideline, they sort of have to adjust it on their own. So you want people to be able to make their own decision, and finding your own comfort zone when you take the olanzapine at night is really up to the individual patient. But generally, people do best when they take it right after their evening meal. Obviously, if they fall asleep 30 minutes later, then they may have to take it later, but that's a fine-tuning thing that patients do on their own. Zyprexa is a really, really effective tool for dopamine excess, really effective tool for overthinking. Yes, it has its risks that one has to consider, but in terms of the risk and benefit, I use a lot of Zyprexa for a lot of people that do not have psychotic conditions, and I'm using it purely as a medicine to treat their overthinking in an off-label fashion, which they agree to, and as long as it helps them and they're aware of the risks and benefits, well, that's an appropriate thing to do. If you're taking Zyprexa, obviously check with your prescribing person that's helping you. Your prescriber ought to be able to talk about that and ask questions that you have. But in my experience, Zyprexa is a safe and effective tool to treat overthinking. And even though it's generically available as olanzapine, I use a lot of it. And if you're thinking about taking it, or if you're concerned about overthinking as a clinical condition, that is really not the depressive aspect, but the thinking aspect. As far as treating overthinking, Zyprexa is a great tool, and you could ask your prescriber about that. And certainly, if you're my patient, you were already talking about it. I'm already talking about it with you. So that's about all I have to say on Zyprexa today, olanzapine. I hope it's helpful to you. As usual, I appreciate the fact that you subscribe and like. It helps other people find the channel, and we get a lot of stories every week now that someone else has heard about this, is starting to see the common sense of the approach to patients with brain chemistry problems, that they are not mentally ill, that they have a medical problem with their brain chemistry, and that's what we're treating with these medications. I hope that's helpful to you. I'm Dr. Dave Psychiatry. Thanks for coming to see me today.